Surgical, Systemic Response, and Metabolic Support Rapid MCQ Review. Let's jump straight into question 1.
Question 1 on C-reactive protein, or CRP. Is it A, secreted in a circadian rhythm with higher levels in the morning? B, increases after eating a large meal? C, is a soluble pattern recognition molecule of the pentraxin family? Or D, is synthesized in lung and kidney in response to IL-6? The correct answer is C. So let's break this down. Pentraxins are this group of soluble pattern recognition molecules, and CRP fits right into this family. Now, under normal circumstances, your CRP is pretty low, but it's synthesized in the liver, not the lung or the kidney, in response to IL-6. And those serum levels, they can increase a staggering 1,000-fold. It doesn't fluctuate with circadian rhythms or eating a big meal. So your exam pearl here, CRP is an absolutely crucial classic marker of acute inflammation.
Question 2. Which of the following is true regarding the inflammatory response following traumatic injury? A. There is an acute pro-inflammatory response caused by stimulation of the adaptive immune system. B. There is an anti-inflammatory response that leads to a return to homeostasis accompanied by suppression of the innate immune system. C. An acute pro-inflammatory response secondary to activation of innate immunity, an anti-inflammatory response, and suppression of adaptive immunity occur concurrently. Or D. Systemic inflammation is strictly related to microbes, and the answer is C. The really critical point here is that traumatic injury rapidly fires off multiple responses all at once. You get a pro-inflammatory innate response triggered by DAMPs, an anti-inflammatory response desperately trying to pull you back to homeostasis, and a suppression of your cellular-mediated adaptive immunity. Recent studies actually show these three are happening concurrently. Your exam pearl. Remember the concurrent nature of innate activation and adaptive suppression immediately following injury.
Question 3. Which of the following is true regarding damage-associated molecular pattern, or DAMP, molecules? A. They function early by activating adaptive immunity. B. PAMPs and DAMPs have entirely different signaling characteristics. C. DAMPs are ligands for a group of receptors broadly termed pattern recognition receptors, or PRRs, which includes toll-like receptors. Or D. They signal only to immune cells. The correct answer is C. DAMPs are these endogenous molecules produced during tissue damage, and they interact with both immune and non-immune cells. It's actually a brilliant illustration of how DAMPs act so much like PAMPs. They both signal right through PRRs like toll-like receptors. The exam pearl for this one, DAMPs are endogenous ligands for PRRs that get released during tissue damage or cellular stress. Question 4. High mobility group protein B1, or HMGB1, A, is detectable in circulation within 30 minutes of trauma. B, is secreted by immune-competent cells stimulated by PAMPs. C, is also secreted by endothelial cells, platelets, and as part of cell death. Or D, all of the above. The answer here is D, all of the above. HMGB1 is literally one of the best characterized DAMPs we have, and what's super fascinating is its diverse sourcing. It's actively secreted from immune cells stimulated by PAMPs or cytokines, actively secreted from stressed non-immune cells like endothelial cells and platelets, and passively released during cell death or necrosis. Your exam pearl, HMGB1 is your classic rapid response DAMP, and it's detectable in circulation just 30 minutes post-trauma. Question 5. The most abundant amino acid in the human body is A, carnitine, B, arginine, C, glutamine, or D, methionine. The answer is C, glutamine. Glutamine is just an absolute powerhouse, making up nearly 2/3 of the entire free intracellular amino acid pool. And that is your exam pearl right there. Glutamine totally dominates the intracellular pool as the single most abundant amino acid in the human body. Question 6. What is the role of mitochondrium DAMPs in the injury-mediated inflammatory response? A. Mitochondrial DNA induces production of HMGB1. B. mtDNA and peptides from damaged mitochondria activate the macrophage inflammasome and the STING pathway. C. They modulate the anti-inflammatory response. Or D. They are directly toxic to the liver and lung. The answer is B. So, cell-free mitochondrial DNA is significantly higher in trauma patients. The release of this mtDNA, along with formal peptides from damaged mitochondria, activates the macrophage inflammasome and the STING pathway, which contributes to sterile inflammation. Now here's a really cool exam pearl. From an evolutionary perspective, mitochondria are actually derived from bacteria, so it makes perfect sense that their DNA retains bacterial features that trigger a massive inflammatory response. Question 7. Which of the following statements is false regarding the hypothalamic pituitary adrenal, or HPA axis? A. It's initiated by the hypothalamus producing CRH in response to cytokines. B. CRH acts on the anterior pituitary to stimulate ACTH secretion. C. CRH stimulates the zona fascicula of the adrenal gland to synthesize glucocorticoids. Or D. Insufficient cortisol can lead to tachycardia, hypotension, and weakness. The false statement here is C. Let's trace the actual flow for a second. CRH acts on the anterior pituitary to secrete ACTH. It is ACTH, not CRH, that travels down to act on the zona fascicula of the adrenal glands to pump out those glucocorticoids, like cortisol. So lock in this exam, Pearl. ACTH is the direct stimulator of the adrenal gland's zona fascicula. Question 8. Enteral nutritional formulas used to treat hepatic failure are characterized by A. Lower fluid volume, B. Lower concentrations of potassium, phosphorus, and magnesium, C. Predigested nutrients and minimal fat, or D. Approximately 50% branched-chain amino acids. The correct answer is D. Hepatic failure formulas are specifically tailored with a protein content of around 50% branched-chain amino acids. Think leucine, isoleucine, and valine. Options A and B are describing renal failure formulas, and C describes elemental formulas. The really critical exam pearl to take away is that this specific profile, high branched-chain and low aromatic amino acids, is designed to potentially reverse encephalopathy in hepatic failure patients. Question 9. Which of the following is true regarding autophagy? A. It's an energy-dependent mechanism removing senescent cells with no inflammation. B. It disposes of damaged organelles normally but provides nutrients during stress. C. It is not stimulated by cytokines. Or D. It contributes to lymphopenia and sepsis. The correct answer is B. Autophagy is a pretty fascinating process. Under normal, everyday conditions, it acts like the cell's garbage disposal for damaged organelles. But during stress, like hypoxia or low cellular energy, it shifts gears to actually provide additional nutrients. Options A and D, those are describing apoptosis, not autophagy. The exam pearl, always differentiate autophagy's unique dual role of organelle disposal and energy provision from the programmed cell death of apoptosis. Question 10. Which of the following cytokines is produced primarily by CD4 plus T cells and promotes T lymphocyte activity and proliferation? A. IL-10, B. IL-8, C. TNF-alpha, or D. IL-2? The answer is D. IL-2. IL-2 is a major player in the immune response. It's produced mostly by CD4 plus T cells. It promotes the cytolytic activity of CD8 plus T cells and natural killer cells, and it helps naive CD4 cells differentiate. The big exam pearl to remember here, IL-2 is absolutely critical for the development and maintenance of T regulatory cells. Question 11. Which statement best describes the role of IL-10 in the immune response to injury or stress? A. It's a rapidly mobilized pro-inflammatory mediator. B. It's an anti-inflammatory mediator that inhibits secretion of pro-inflammatory cytokines like TNF and IL-1. C. It's a pro-inflammatory mediator promoting Th17 development. Or D. It's a pro-inflammatory chemoattractant secreted by macrophages. The answer is B. IL-10 acts heavily in an anti-inflammatory role to reestablish immune homeostasis. It does this by inhibiting the secretion of those pro-inflammatory cytokines through the downregulation of NF-kappa B signaling. The exam pearl. Think of IL-10 as your primary brake pedal. Its main function is to reestablish immune homeostasis by regulating the duration and magnitude of the inflammation. Question 12. Which of the following is true regarding transcriptional events following trauma? A. Over 80% of cellular functions and pathways in leukocytes demonstrate a shift in gene expression following blunt trauma. B. Changes take 3 to 5 days to develop. C. Changes occur rapidly but are transient for only 1 to 2 days. Or D. Patterns vary widely depending on the injury type. The correct answer is A. This brilliantly illustrates the sheer scale of the body's response. We see a massive transcriptomic shift where over 80% of cellular functions and pathways in leukocytes are fundamentally altered. Your example? This massive genomic shift after blunt injury is incredibly rapid, starting within just 4 to 12 hours, and it is prolonged, persisting for days to weeks. Question 13. Which of the following statements about monocytes and macrophages is false? A. They are primary effector cells responding to danger signals. B. Macrophages undergo M1, which is pro-inflammatory, or M2 activation. C. Monocytes and tissue macrophages are derived from a common bone marrow progenitor. Or D. An M1/M2 imbalance in the lung contributes to acute lung injury. The false statement is C. And here's why. Monocytes are indeed derived from bone marrow progenitors, but resident tissue macrophages? They're actually derived from embryonic precursors, not a common bone marrow progenitor. Exam Pearl: always differentiate the distinct bone marrow origins of circulating monocytes from the embryonic precursors of tissue macrophages.
Question 14. Platelet-specific TLR4 activation results in binding and activation of what cell type, with subsequent extracellular trap formation? A. Macrophage. B. CD8 plus T cell. C. Mast cell. Or D. Neutrophil. The answer is D. Neutrophil. Platelets can actually detect PAMPs and DAMPs using TLRs. When activated, they bind to neutrophils, causing those neutrophils to extrude their DNA and form neutrophil extracellular traps, or nets. The exam pearl: this platelet neutrophil binding via TLR4 leads to net formation, which is kind of a double-edged sword. It successfully traps bacteria, but it comes with a real risk of collateral endothelial cell damage.
Question 15. Which of the following statements correctly pairs the type of CD4 plus TH cell with its description? A. Th1 is generally anti-inflammatory. B. Th2 is generally pro-inflammatory. C. Th17 is strongly anti-inflammatory. Or D. Th1 is generally pro-inflammatory, promoting recognition and killing of intracellular pathogens. The correct answer is D. CD4 plus helper T cells are pretty strictly divided by function. Th1 cells are your cellular pro-inflammatory fighters handling intracellular pathogens and secreting IL-2 and TNF-alpha. Th2 cells are generally anti-inflammatory and drive your humoral immunity. The exam pearl: Th1 equals pro-inflammatory and cellular, Th2 equals anti-inflammatory and humoral.
Question 16. Which of the following statements characterizes metabolism after injury and infection? A. An initial hypometabolic state followed by a dramatic increase in energy expenditure. B. Adipose stores are the predominant energy source. C. Increased energy expenditure is mediated by sympathetic activation and catecholamine release. Or D. All of the above. The answer is D. All of the above. Metabolism post-injury is a truly biphasic process. Initially, you're looking at a hypometabolic ebb state, which then abruptly flips into a massive hypermetabolic flow state driven by sympathetic activation. And through all of this, lipid metabolism provides the primary energy source. Exam pearl: really understand this shift from that initial hypometabolic state directly into a hypermetabolic state driven heavily by catecholamines.
Question 17. What is an appropriate number of kcals and grams of protein per day for a 70-kilogram patient during a state of severe stress? A. 2,100 kcals, 70 grams. B. 4,200 kcals, 175 grams. C. 3,360 kcals, 140 grams. Or D. 1,925 kcals, 70 grams. The answer is C. For severe stress, the guidelines recommend a baseline of 30 to 35 kcals per kilogram per day. So 30 times 70 kilograms gets you 2,100. Then we apply a 1.6 adjustment factor specifically for severe stress, giving us 3,360 kcals per day. For protein, the target is 2 grams per kilogram per day, which equals 140 grams. Your final exam pearl: commit the specific mathematical formula of 30 to 35 kilogram per kilogram with the 1.6 multiplier and 2 grams per kilogram of protein to memory.